Hello, everyone, and welcome to another Whiteboard Wednesday from Advocates for Human Potential. Every Wednesday, or every Whiteboard Wednesday, rather, we take a quick look at issues affecting public health and human services organizations so we can give you real world solutions for real world problems. My name is Kristen King, and I'm the lead for online events and digital strategy over here at AHP. That includes everything from live social media events like this one, to webinars, to virtual classrooms, to massive online conferences, and more. Today, I am joined by my friend and colleague, Phil Rayner, who's a senior program associate here at AHP and one of our in-house experts on integration. I'm going to bring Phil on the screen with me in just a second here. Hi, Phil.
Hey, Kristen.
Phil was not able to join us last week as planned due to some technical glitches over in New York. So he's here this week, and he's going to talk to us about health insurance navigators and their role in behavioral health integration, which was a question that came up during last week's live stream. Phil has been a clinician for over 30 years, and he's one of my very favorite people to talk with about integration. We actually just did a 20-week echo on integration in public health settings earlier this year. So we had a lot of fun with that. And Phil's coming to us from AHP's Albany, New York office. So, Phil, today we're talking about health insurance navigators. And this is, again, based on an audience question from last week about understanding exactly what it is that navigators do. But before we get into the nitty gritty and all the details of this, I want to make sure we understand an example of like the context where a health insurance navigator would be useful. And so I know that you worked with a large private healthcare provider in New York on this very thing. And so I'd love it if you could just tell us a little bit about that project.
Sure, I'd be happy to. Yeah, I was working with a client who was serving a high percentage of elderly clients who had complex and chronic health conditions. And these patients were almost all Medicare members as elders. Um, and what happened was that many of them were avoiding visits because of their limited income and they were having difficulty meeting copayment expenses. Many of them were also skipping doses of medication for the same reason. And of course, that was having very negative health consequences for them. So I was able to provide some guidance to in regard to insurance navigators and their role, so that a client could help their patients know what um, resources were available to them, the treatments and supports that were available through their insurance. And it made a huge difference in how many patients were participating in treatment, and really improve their health outcomes.
Yeah, I bet. Like the more information our patients have about their treatment options, especially helping them know which ones they can actually afford so they can do it, the better able they are to participate in those options and to do it consistently. And so I want to hear what happened next, like how that consultation played out. But let's talk a little bit more about insurance navigators in the big picture first. And so, folks who are watching, as we go through this conversation today, we really do want it to be a conversation. So please feel free to comment with any questions or experiences you have. We love to hear from you in real time. You'll see me sometimes looking at the screen and sometimes looking to the side. I'm checking the comment stream to make sure that I don't miss any questions that you may share. You can also, if you prefer to be anonymous, just send a private message to the page. And either way, we'll get back to you either in the live broadcast or in a comment later. So moving back to this conversation we're going to have right now, Phil, the Health Insurance Navigator role was developed as part of the Affordable Care Act, the ACA, to help consumers navigate this new health insurance marketplace, which many of them had never had to do before. You know, most people were not necessarily buying insurance in an open marketplace. So what kinds of specific support can a navigator give me if I'm a consumer who's trying to buy a plan or understand what's in my coverage?
Well, navigators are tremendous support for people because they're not tied to or obligated to any particular health plan because they're not reimbursed by the health plans, and so they are able to give unbiased recommendations to someone who is seeking insurance about which option might best meet their medical needs, and help them then to establish eligibility, enroll in coverage through the marketplace, and even to qualify for insurance affordability programs for financial support. Um, They also provide outreach and education to help raise awareness about the marketplace and refer consumers to to a health insurance ombudsman and consumer assistance when that's needed. So they're really very helpful in getting people pointed in the right direction depending on what their healthcare needs are.
Well, and that's a big job. Like how many of these people are there? Are they just a few or are there a lot?
Oh, every state is required to have them. There are just many of them around, both navigators as well as another kind of a sister called a certified application counselor, and we'll get into that a little bit later as well. But there are many of them, and they can be found through healthcare.gov and then connected to the local state resource. Um, the job is a big job. This year, the CMS has awarded grants to 30 organizations who will serve as navigators in what are called federally facilitated marketplace states. Um, with the COVID-19 pandemic that's been going on, many people have lost their jobs or may have been uninsured for a period of time, are getting help from navigators now to enroll in Medicaid and the Children's Health Insurance Program.
Okay. So obviously there's a lot of people in the current environment who need the support. So that's why they awarded so many grants. So
Mhm.
you mentioned that these grants are going to organizations, not necessarily like specific navigators. So tell us more about the organizations and how they oversee the health insurance navigators.
The organizations that are responsible for managing navigators are called Certified Designated Organizations, or CDOs. The CDOs themselves might be community health centers, that might be typically larger healthcare providers, they may be hospitals or social service agencies.
Okay, so if I'm an ACO, I'm an accountable care organization, I can apply for my organization to become a CDO if there's not already one in my area.
Yes, absolutely. And many do.
Okay, so say there's a need for a CDO in my state, in my region. What exactly do I have to do when I become one?
Um, well, you would become one by first completing an application to become one through the CMS website. And the CDOs train and oversee people who are called certified application counselors. I mentioned them earlier, or CACs. And they're directly involved in helping to get people connected with different health insurance options. They do the navigation. The CACs are specifically trained to help consumers who are seeking health insurance coverage options through a federally facilitated marketplace or a state marketplace, because the states operate their own system and oftentimes they mirror the federal system. Sometimes they have their own
Mhm.
process. CDOs set the processes for making sure staff and CACs complete the training and keep a roster of trained CACs and their identification numbers. They set processes and safeguards for handling patients' personally identifiable information. We have to make sure that we're protecting privacy and health
Mhm.
information. And they create the processes to prevent any conflicts of interest for CACs. To be sure that someone who's functioning as a CAC is not also being reimbursed by a insurance provider, so that there isn't a um, incentive for them to recommend a given program.
Right. Well, and so that really helps consumers to know that they're getting the best recommendations for their needs and it's not being influenced by someone else's financial interests.
That's
So that's very reassuring.
right.
Yeah.
Yeah.
So, we know some states are running their own marketplace. They're not participating in the federally facilitated marketplace, which is a mouthful, the FFM. We can say that moving forward. So, tell us more about what's happening in the states that are managing their own insurance exchange.
Yeah, well, CMS requires that all states have an assister program, and many of them have navigators and the certified application counselors. But the states can set up their own processes. Every state manages their own marketplace programs. They also provide access to navigators to support consumers. And each state is a little bit different in how they operate. So the best bet is to explore the specific program that's available in each state. And you can usually connect to that by going to healthcare.gov, which brings you to the federal site for the marketplace. And then you can enter in your specific location, and that will take you to the resources that are available state by state.
Okay, and so both consumers and provider organizations can use the same resource to find out what's available in their area.
That's correct. Yeah. It's nice to have it a
Okay.
little bit simpler that way.
Yeah, really keep it streamlined. And then everybody's getting the same info at the same time. So that makes it easier too.
Right.
So, so let's say I'm an ACO. I have some patients who are not currently insured. What's the best way for me to give them information about health insurance navigation so we can get them some coverage?
Well, I find it really helpful, as is often the case. Providers will keep information about these programs available in their waiting rooms, and CMS makes a range of brochures on different specific populations and communities available. So if I'm a provider, and let's say I have a large African American population that I'm working with, there are brochures produced specifically addressing concerns that might be relevant to that community. And so there are a lot of resources that you can have available in your office. And then, of course, having direct conversations with your patients as they're coming through, or if it appears that somebody's not keeping all of their appointments for a given reason, to even ask about that and then to help make that connection, because a lot of people don't know how they can get adequate coverage for their healthcare needs. They just, as I had mentioned earlier, many times they just stop getting health care or stop filling
Mhm.
their prescriptions because they're trying to manage a budget. You're choosing between food and medication sometimes.
Yeah, well, and having that information available to everybody so anyone can pick it up if they need it, and also just offering it as a matter of practice all the time and not making assumptions can take some of that like defensiveness or that fear of bringing it up out of the conversation because it's just information we give to everybody.
Right, right. And
Yeah.
with that information and their ability to connect with a health plan that's going to really meet their needs, their health outcomes are likely to improve, and they're going to have a reduction in their overall healthcare costs. So it's really a win-win for them.
Well, this is true for primary care and behavioral health care, right?
Absolutely. The specifics will vary depending on whether your state participates in the federally facilitated marketplace or manages its own exchange, but both primary care and behavioral health care are included. And some people may not be aware that some years ago there was legislation that required parity in behavioral health care, and so
Hmm.
some people might not have been able to get health care coverage for their behavioral health needs. Um, if you go back 10 or more years ago, that's no longer an issue. But there's still a lot of variability in what different plans cover. And so it's important to have someone who can help guide people toward a plan that will meet both or all of their healthcare needs, including their behavioral health concerns.
Mm. Well, and it's really important to recognize there are a lot of different plans. And so the plan that's right for me may not be the plan that's right for you, may not be the plan that's right for one of your clients. And so having someone who can really, kind of lay out those pieces and help people figure out what do they need and what do they not need to really manage their costs and put the right money in the right places, right? Like that is, it's just so important.
That's exactly right.
Yeah.
It doesn't take too many expensive medications in the course of a month to overwhelm somebody's budget. And so having a plan that provides enough coverage for that can make it much more likely that they're going to comply with the recommendations. Um,
Yeah.
you know,
Well,
so,
as you said earlier, the more they consistently follow the recommendations, the better their health improves, the better they're able to respond to the treatment because they're getting the full course of it. So the lower their healthcare costs are going to be both in the present and also over time.
that's correct. The whole goal of integration here is to get better, more complete care and services for our patients with lower costs and better outcomes. And like you were saying, just a moment ago, patients with adequate insurance coverage are more likely to participate in recommended treatments, which will
Mhm.
reduce their costs and improve outcomes. Using insurance navigators should absolutely be part of your overall ACO strategy. It factors into integration in terms of your workforce development and your partnerships. When you're selecting a strategy, like Patrick had talked about last week, and then implementing it, consider whether your organization should become a CDO and actually provide health insurance navigation, um, or whether you want to partner with an agency in your area that's already a CDO to provide these services to your clients. They can be an important part of your ACO provider community. Whether you're in a state that's managing its own exchange or a state with a federally facilitated marketplace, your
Mhm.
integration model can include steering patients directly to the right coverage and services, or connecting them with a partner who does that.
Well, I love how you tied it back to everything we talked about last week, where we were really selecting the model of integration for our ACO. We were looking at, what does the data support this? And then how do we tie it into the culture? And it all came back to the people. And so, what I'm hearing from today's conversation is that integration is really focused on, like you said, like better addressing the full range of issues that a client's going to have, making sure that the needs that are present in your community are addressed by the coverage that people have access to, right? And getting them connected to those right pieces. And that when they have adequate insurance coverage and they understand it, and it's coverage that really covers the services that they need, that's the key to helping them take advantage of the range of services you're offering directly in your agency location, and then also through those integrated partnerships you've created as you build your ACO and you really embrace this model of integration.
That's exactly right. In order to make all the pieces work together, people have to be able to get reimbursed for the services that they're needing. The provider needs to be able to get reimbursed, and the patient needs to know that they'll be able to afford the services. Otherwise, the whole system's not going to work because the patients won't be able to actively engage and follow through fully in the treatment recommendations.
Yeah,
So it becomes a central point to making the system work.
absolutely. So I'm totally sold on this. So let's say I'm an ACO. There's not a CDO in my area. So there's not a group of insurance navigators. So I'm committed that I'm going to make this happen, right? Because I know that it's going to get more people enrolled in my services. I know that it's going to help the overall health of my community. What do I do to apply to become a CDO?
Well, fortunately, you can get all the information and the actual application on the CMS health insurance in CMS's health insurance marketplace information. I think I had sent you a link. Do you have that?
Yeah, I have it right here. I'm going to drop it in the comments so folks can check that out if they want to apply. So let me just put that over here. There we go.
Great.
So, I want to remind everyone, just to echo what Phil was saying a minute ago about Patrick's presentation last week, insurance navigators are one part of a larger integration strategy. And hopefully, after today's conversation, it's clear exactly what part they play and why that's so important. But we also have a great free resource that I want to invite everyone to download. We talked about it on last week's Whiteboard Wednesday, and it's our top 5 tips for ACOs integrating behavioral health care. So let me just pull that up on the screen for a second. So you can get this at no charge through our website, which is ahpnet.com. And I'm going to put the direct link to that in the comments. I'll also add it to the description after the broadcast. So if you rewatch this video, if you share it with a colleague, it'll be right in there. They won't have to scroll through. So Phil, let's bring this back full circle. I want to hear what happened with those folks in New York after you got them set up with the certified application counselors, those insurance navigators, to help their parents, help their patients, some of whom are parents, I'm sure, navigate the healthcare system and get the coverage they needed. What happened next?
Well, when they were started to coach the patients and give them guidance to connect with the certified application counselors and navigators, and again, this was largely a Medicare population. The compliance improved dramatically. People were able to keep their scheduled appointments, and many of these patients were working with a number of different providers, and so they had multiple appointments within a given month and multiple medications that they were taking. And as they became able to keep those appointments, to afford to keep those appointments, and to fill their prescriptions, their um, their health improved, their outcomes improved, their satisfaction was greater, and so there was an overall positive benefit for everyone involved.
Well, that's exactly what we were just talking about.
That's right. And we were able to expand. They were able to expand services to formerly uninsured patients who had been using the emergency department for medical care, when their needs were more severe and most costly. And so
Mhm.
that was another savings for everyone involved.
Yeah. And so this is really making available the right care at the right time at lower cost, with better outcomes. So it's just a win across the board.
Right.
So what advice would you give to an ACO or another organization that's not currently using certified application counselors or some other type of health insurance navigators? What would you suggest?
Well, insurance navigators and certified application counselors are available now to help ACO patients qualify to get the care they need. I would urge I would urge people to identify the certified designated organization in their area, or consider applying to become a CDO to ensure the patients that they're serving have adequate healthcare coverage for themselves and their families in regard to their overall healthcare. We still have this linguistic distinction between primary care or physical health care and behavioral health care. But the fact of the matter is it's all health care. And if our patients don't have all of their health care needs adequately addressed, um, their health problems are going to worsen because we're not able to address the whole picture.
Yeah. Phil, I do have one question. Are there limitations on who like can and cannot be a CDO? Are there any exclusions that we should know about, or like where would we find that information?
That's a great question. Again, you can find more information about that on the CMS site in regard to navigators and CDOs and CACs. But essentially, if a provider is in a state that is not managed by an FFM, um, then they would have to identify what's going on in their particular state in regard to how they set up navigators and how they set up certified application counselors. Um, so if if they're if they're in a state that manages itself, they would not be able to apply through the CMS site to become
Hmm.
a CDO. The other case would be if you have an individual, an organization that has a direct contract with an insurance company or an insurance provider to provide services, or is reimbursed by an insurance company directly for services. It creates a conflict of interest. And so they would not be able to apply to be a CDO as well. But those are unusual circumstances. For the most part, um, CDOs and provider organizations would be able to apply.
Okay, got it. Thank you. And again, folks, the link to that marketplace site with more information, if you want to apply to be a CDO, that's in the comments. So with that, we're coming up at the end of our time. I want to remind everyone to grab that free top 5 tips for ACOs integrating behavioral healthcare that's available through our website. Again, that link is in the comments. You'll find it in the video description. Thank you to everyone who joined us today. If you're watching this on the replay, please feel free to add your comments and your questions. We'll get back with you by replying there. Phil Rayner, it was so great spending some time with you today. Thank you very much. We will hopefully have you back again in the next couple weeks here. Folks, I'm Kristen King. On behalf of my colleagues at AHP and also my online events team, thank you for joining us, and we will see you next time for Whiteboard Wednesday. Have a great rest of your day. Bye now.